Here we begin today with what county health leaders are calling a significant spike in new coronavirus cases.
Yeah, numbers released this afternoon show 1,264 new cases of COVID in San Diego County. That's the highest we've seen in a single day since early February. The county tells us this is part of a larger trend, as we've kind of seen happen over the last few weeks and months or so, not an isolated spike that we're seeing today. They say between June 21st and July 20th, more than 6,500 San Diegans tested positive for COVID, and of that group, 89% were not fully vaccinated. Dr. Wilma Wooten says this is proof vaccines are effective in preventing severe illness or death. In fact, 98% of the people who have been hospitalized in the past 30 days were not fully vaccinated.
And this afternoon, San Diego County Supervisor Jim Desmond released a statement encouraging San Diegans to get vaccinated. He said, quote, "If you've been on the fence or waiting to receive the vaccine, it is time. This vaccine will keep us from shutting down our economy again and will protect lives." So far, more than 1.9 million San Diegans are fully vaccinated.
Well, amid this surge, more San Diegans who have the virus are turning to specialized clinics to help keep them out of the hospital. And our Jason Sloss is live at one of those clinics in Escondido with a look at how they're helping. Jason.
Yeah, they're called monoclonal antibody regional centers. We're outside one of the 4 clinics operating around the county right now, and they are getting busier as more people test positive for COVID.
Amazing results at keeping people out of the hospital, giving them that immune system boost that they need.
Dr. Christian Ramers, an infectious disease specialist with Family Health Centers of San Diego, is referring to monoclonal therapy, which is used to treat people with COVID who are at high risk for severe illness. That includes people over 65, those with diabetes, kidney disease, high blood pressure. Obesity is also a major factor. The treatment uses monoclonal antibodies, which are proteins made in a lab that help boost the immune system to attack the virus. Dr. Ramers says the key is to act fast.
They have to get the treatment early. So this really only works if it's within the first 10 days of symptoms. So that means people need to get tested early and then really get in touch with us as soon as they can.
It's a 1-hour infusion followed by a 1-hour observation period, and it's free. As COVID cases dipped in May and June, so did demand for the treatment, but now it's picking back up as the county sees a spike in cases.
We are actually quite busy. In fact, we're scheduling out about 2 to 3 days at this point, so we're essentially reaching our capacity, which is a good thing. It's an incredibly effective therapy.
Dr. Ramers says the therapy delivers a 75 to 85% reduction in the risk of hospitalization, and those already vaccinated who still have symptoms can still get the treatment.
Officially, they should have at least one high-risk condition that really puts them at risk of being hospitalized. And they definitely have to have symptoms. We're not using this for asymptomatic people at this point. And we know from in vitro or lab experiments that the combination that we're using, which is the Regeneron cocktail, casirivimab and imdevimab, is still very active against the Delta variant. So it should work just fine.
And he says of those treated locally, only about 1% ended up having to go to the hospital anyway. Now, aside from the center here in Escondido, there are also centers in Chula Vista, Vista, and Hillcrest. It's by appointment only, so there is a screening process to go through. We'll have more on our website at fox5sandiego.com. Live in Escondido, Jason Sloss, Fox 5 News.